Hi, I'm Lynn Block. I'm the CEO at Manning Regional Healthcare Center. I'm here today to provide you with an update on what's happening here at the hospital in regards to COVID-19. At Manning Regional, we've tested several individuals who presented with symptoms that are aligned with the COVID-19. However, to this point, we've had no positives, although we continue to be very vigilant in testing when able, when patients meet the appropriate criteria as put out by the Iowa Department of Public Health. We think it's important that we're not only vigilant with the testing kits that are available, but also with the personal protective equipment. And as you've probably seen on news media, nurses and physicians and healthcare workers are required to wear personal protective equipment every time we test somebody. A majority of the care that we provide at Manning Regional Healthcare Center is on an outpatient basis. Roughly 90% of the care that we provide is outpatient. We have yet to see that influx of patients with COVID-19, which would, of course, impact our inpatient flow of patients. Since COVID-19 started, it's impacted every single one of the departments at the hospital in one way or another. A majority of the business that we do here at the hospital is on an outpatient basis. So if you think about the services that we pride ourselves in, from our specialty clinic services to the recovery center services, senior life solutions, all of our therapies, those are all outpatient services. So when we tell people to stay home and not go out, that includes coming out to the hospital to get their routine health care and the services that we offer here. So dramatic impacts in the number of outpatients that we've seen here at the hospital, thereby impacting the number of staff. And we have done some reduction in hours for some of our staff, recognizing that they're not taking care of nearly the number of patients that we're accustomed to caring for. So in preparing our staff for dealing with COVID-19, we do daily incident command, where we bring in a group of our key leadership staff and talk about cases that we're seeing, testing that we're doing. As I said, we haven't seen any cases here. However, we know that the counties around us are seeing cases, and quite honestly, it could be just a matter of time before we see additional cases here in Carroll County and even here at Manning Regional Healthcare Center. So we know how important it is to prepare and work with our staff. So on a department level, people know how to deal with that potential patient that could be coming in that's positive, and even with a potential influx of patients. I'm really proud of our staff in the way that they're handling this situation. It's difficult for everyone knowing that what could be going on in people's personal lives as it relates to COVID, how it's affecting, maybe they have loved ones in facilities that they can't go and be with, and how hard that is. I think that even those of us who have children at home who aren't attending school, how we're dealing with that, young children and the way their daycare situation could be impacted. The list goes on and on about how our staff are impacted by this every day, and they have done an excellent job of trying to put that aside as much as possible and still being able to come to work and take care of the patients. I've been really impressed with our community in how they are following the recommendations and not coming out without calling, and especially if they're experiencing a fever or any of the respiratory symptoms, or they've been exposed to someone that they know has been positive for COVID-19. They're doing a great job in following the rules that Iowa Department of Public Health has asked them to follow. And if they do need to come out, we absolutely want to provide that care for them, but we want them to call ahead so we can be prepared and make arrangements and provide the best care possible for them. The community continues to be supportive not only of us, but of the businesses in town, and we're in turn trying to support those businesses as well as much as possible. The experts tell us that the peak of this illness is yet to come, possibly 2 or even 3 weeks out before we see the peak here in Carroll County. And so we would just like to advise everyone to continue to follow the advice and to stay home, to self-quarantine if you're feeling any of the symptoms, to practice good hand washing, good hand hygiene, All of those things continue to be important now and in the near future as we work together to try to deal with this public health crisis that we're all facing. As I close today, I want to thank you for continuing to support Manning Regional. And please know that the health and safety of our staff as well as our community continue to be the priority of our staff, our providers, and our board of directors.